Anthony Fauci says it's possible vaccine trials could end early if preliminary results show overwhelmingly that a vaccine is safe and effective. And to talk that through with us is Dr. Daniel Korytskas, Chief of the Division of Infectious Diseases at Brigham and Women's Hospital. Good to see you.
Good to see you, Emily.
So not only did we hear this from Dr. Fauci, but the CDC has asked states to have distribution sites ready by November 1st. Is it possible we could have a vaccine that quickly, and how unusual would that be?
Well, it's not unusual. I think people need to understand that all clinical trials of this sort have an independent data safety monitoring committee that takes interim looks at the data. Every several months or every several thousand participants, they will look at the data, first of all, to make sure that there aren't any safety concerns. And then in this situation, to see, is there overwhelming evidence of effectiveness, of protection of the vaccine, so that we don't have to wait till the very end of the trial to know that the vaccine is working. There are very strict rules that are set up in advance of the trial in order to determine when such decisions might be made, so they can be done in an ironclad way that's not really subject to outside interference.
I think this is such an important point because I don't think a lot of people know that. So even if a vaccine did come this year, I think there's a question of buy-in potentially. Is there a way to know how many people maybe may not be willing to get a COVID-19 vaccine?
It's hard to really get a detailed sense of exactly how many people might not be willing. I've heard numbers of around 30% of people may have some concerns. The more important thing is that all of us really need to do a job at making sure that everybody understands why getting vaccinated is so important once we have a vaccine that is proven to be safe and effective. And getting that message out is going to be everybody's responsibility.
All right, let's talk about some new research out today showing that critically ill COVID patients who received just common prescription steroids, they were more likely to survive the virus. Why do we think steroids could improve outcomes there?
Steroids can improve outcome because they are anti-inflammatory drugs. And we know that a lot of the damage to the lung that occurs from COVID-19 is not only due to actual viral infection of lung cells, but is due to the immune response and the inflammatory response that occurs as a result of the virus. We already had some data in June from a study done in Oxford or run by Oxford University in England that steroids might be effective. And what we saw published today were several additional trials, as well as an overarching analysis of all the trials lumped together that confirmed that original finding, and it's suggesting that people with severe disease and those who are critically ill with COVID-19 might benefit from steroids.
It's a promising option. All right, finally tonight, the American Academy of Pediatrics, they're saying in the last 2 weeks of August, there was a 17% increase in child COVID-19 cases in the U.S. Back to schools, it's here. You know, what is your advice for parents who have kids returning to in-school learning about the best ways to keep that risk low?
I think that children in school should be doing the same thing that everybody else, wearing masks, washing or disinfecting their hands frequently. I think we can be reassured because rates in Massachusetts are so low that students returning to school are going to be at very low risk of acquiring COVID-19.
Right, that 7-day average positive test rate, 1%. Okay, Dr. Daniel Korytskas, thank you for your time. As always, we really appreciate it.
Sure thing.